Welcome back to the Score Builders Question and Answer podcast. This podcast provides members of the Score Builders team with the opportunity to explore challenging multiple-choice examination questions with students actively preparing for the licensing examination. Ready? Let's go. During an evaluation, a physical therapist performs the elbow flexion test to reproduce a patient's upper extremity symptoms. Which of the following best explains the mechanism behind this test? Option 1, compression of the ulnar nerve within the cubital tunnel. Option 2, compression of the median nerve as it passes through the pronator teres. Option 3, ischemic compression of the radial artery reducing blood flow to the forearm. Option 4, stretching of the posterior interosseous nerve beneath the supinator. The elbow flexion test is a provocative maneuver used in clinical practice to help identify nerve compression around the elbow. By sustaining the joint in a flex position, pressure and tension are altered within specific anatomical tunnels, which may reproduce the patient's neurological symptoms. This test is often included when differentiating between possible causes of upper extremity pain, numbness, or tingling. The key to this question is understanding what happens anatomically when the elbow is held in sustained flexion. Different nerves around the elbow are affected differently by elbow position, and knowing which nerve is most stressed by flexion is what separates the correct answer from the distractors. Let's build that picture before we dive into the options. Let's explore each of the options. Option 1. Compression of the ulnar nerve within the cubital tunnel. When performing the elbow flexion test, the patient depresses both scapulae, then fully flexes both elbows while extending their wrists and holds the position for 3 to 5 minutes. The test is considered positive for cubital tunnel syndrome if tingling or paresthesia is noted in the ulnar nerve distribution of the forearm and hand. Sustained elbow flexion decreases the space within the cubital tunnel, increasing pressure on the ulnar nerve and reproducing neural symptoms. Option 2. Compression of the median nerve as it passes through the pronator teres. This option describes pronator teres syndrome, where the median nerve is compressed in the forearm. Symptoms are typically provoked by resisted pronation or repetitive gripping tasks, not by holding the elbow in flexion. Pronator teres syndrome is a real clinical entity, but holding the elbow in flexion does not significantly stress the median nerve at the pronator teres. The mechanism simply doesn't match the test being described. Option 3. Ischemic compression of the radial artery reducing blood flow to the forearm vascular compromise is not the intent of the elbow flexion test. Compression of the radial artery would not occur with sustained elbow flexion. The elbow flexion test is a neural provocation test, not a vascular test. If we were assessing vascular compromise, we would use entirely different tests, such as the Allen test for radial and ulnar artery patency. This option can be eliminated quickly because it describes the wrong type of tissue and the wrong mechanism entirely. Option 4. Stretching of the posterior interosseous nerve beneath the supinator. This option describes radial tunnel syndrome, which is typically aggravated by resisted supination or extension of the middle finger. Elbow flexion alone does not create significant stress on the posterior interosseous nerve. Radial tunnel syndrome involves the posterior interosseous nerve, a branch of the radial nerve, as it passes beneath the supinator muscle. Wrong nerve, wrong mechanism. When we consider which nerve is most directly stressed by sustained elbow flexion and which tunnel narrows with that position, the ulnar nerve within the cubital tunnel is the clear and only answer. The correct answer is option 1. Let's explore the all-student data. 56% of students selected option 1, compression of the ulnar nerve within the cubital tunnel. The correct response. 27% of students selected option 2, compression of the median nerve as it passes through the pronator teres. 10% of students selected option 3, ischemic compression of the radial artery, reducing blood flow to the forearm. 7% of students selected option 4, stretching of the posterior interosseous nerve beneath the supinator. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. This question is a physical therapy examination question, which represents approximately 24% of all exam items. This question is a Level 1 question, since the question requires students to possess basic foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Looking to review related academic content, check out page 108 in PT Exam, the complete study guide. Thanks for joining us on the Score Builders Q&A podcast. See you next week.